Hi everyone, today I wanted to talk about something that feels both scientifically important and personally relevant. Cardiovascular kidney metabolic syndrome, or CKM, specifically in older populations. I chose this topic because both of my grandparents live with diabetes, and I've seen how chronic illnesses can slowly reduce a person's independence. This week's article gave me a clear picture of how CKMs directly impact older adults, especially when it comes to daily functioning. So the study I reviewed was published in Frontiers in Public Health in January of 2025, and it followed nearly 6,000 adults in China using data from the China Health and Retirement Longitudinal Study from 2011 to 2018. Researchers grouped participants into CKM stages from 0 to 3, then tracked how these stages related to disabilities in daily living, such as bathing, dressing, or cooking. They found that people in CKM stage 3 had a 33% higher risk of activity of daily living, or ADL, disability compared to those in stage 0. And adults age 75 and older saw an even steeper increase, which was a notable 67% higher risk of ADL disability in stage 3. And among the participants, there was also one final group that stood out, which was the low-income group, as CKM was strongly tied to disability and up to 48% higher risk for those in stage 2 or 3 within the lowest income bracket. CKM syndrome also often involves multiple systems, which can begin with the heart, kidneys, and usually often involve metabolism in some way, shape, or form, as they often worsen altogether simultaneously. In older adults, diabetes can cause nerve and muscle damage, kidney disease adds to fluid imbalances and fatigue, and the heart disease often just reduces stamina. Excuse me, and these overlapping conditions erode a person's ability to live independently. On top of that, mental health issues like depression and anxiety are often more common in people with chronic disease. That emotional burden can lower motivation, limit physical activity, and speed up decline. This study highlighted how physical and mental health interact and how both must be addressed to preserve independence. So here are three key takeaways for current healthcare providers as well as future healthcare providers to take away from this study. The first and foremost is to start functional screening early, especially in adults over 65 with diabetes, hypertension, or chronic kidney disease, even if they're not showing any symptoms. Second is to prioritize support for lower income older patients as they face the steepest rise in disability risk as CKMs progress. These patients may need help with transportation, access to healthy food, or medication coverage in general. And third is going to be to coordinate care across systems, as CKM is a very complex condition. There is no one answer to the condition, to the syndrome, and there is no end-all be-all solution by any means. As older adults benefit mostly from team-based care that includes primary care, nephrology, cardiology, physical therapy, as well as social services. And so what are the barriers and health disparities, and how can we address them? Managing CKM in this population isn't just about writing prescriptions. Barriers like cost, transportation, and access to specialists can delay care. And in some communities, age-related decline is often seen as inevitable, so the symptoms may be ignored. But health literacy also plays a huge role, as people may not understand the connections between these diseases or how to prevent the complications that come with them. And then there's finally food insecurity, which is a major issue for people with diabetes or kidney disease. If someone can't afford fresh food, then they obviously can't follow dietary guidelines, and all of this worsens outcomes and widens disparities further. And so CKM is a major driver of disability in older adults, especially with those with limited income. And it's not just about the heart or kidney lab results, but it's also about preserving independence and quality of life. And as future healthcare providers, we can make a difference by screening earlier, coordinating care, and advocating for better access, especially for the most vulnerable populations. Thanks for listening, and I'd love to hear your thoughts.